have to tell you, I don't feel any less fulfilled than I did walking away from a successful code. It's different, but it feeds my soul. I know I'm making a difference. I can feel it. I can see it. I can touch it. And that's exciting for me. And it's exciting for me because I also have that opportunity, thank you, Audrey, to tell other nurses, you can do this. It's not going to look the same for you as it's going to look for somebody else. That's a good thing. That's how we get innovation. That's how we make these differences. If we all did things, here's the QA part of this. If we all did things the way, what we've always done and the way we've always done them, we would not be as far along as we are. Not as a profession, not as individuals, not as an entity delivering healthcare.
Welcome to Nursing Beyond the Bedside. I'm Audrey, your host, and a nurse who pivoted my path several years ago. After 8 years as a critical care nurse, I was ready for change. I craved higher pay and more flexibility, but was struggling to find a clear path forward. Fast forward through positions in recruiting, customer success, and marketing, and many lessons learned along the way. Today, I run Pivot Path, a company dedicated to empowering nurses to redefine their careers. This podcast is designed to help you navigate the journey from clinical bedside nursing to a fulfilling career that aligns with your passions and goals. Here, you'll discover inspiring stories from nurses who've gone beyond the bedside, successfully transitioning to non-clinical roles, or redefining their nursing career. Join us as we hear their stories and share actionable strategies to help you make your own leap. Whether you're a new listener curious about what lies beyond the bedside, or a returning audience member in need of some fresh motivation, this podcast is your go-to resource for exploring new opportunities that can transform your career. Let's get started. On today's episode of Nursing Beyond the Bedside, we have Jill Pollander joining us. Jill is the Vice President of Patient Services at the National Organization for Rare Disorders. She oversees programs that support patients, families, and caregivers in the rare disease community, driving initiatives to optimize access to care. Jill engages with diverse stakeholders, including patients, advocacy groups, and pharma, to ensure voices are heard and collaborations are fostered. With a multifaceted healthcare background as a registered nurse, Jill has experience from the emergency department to long-term care, specializing in pain management and palliative care, academia, and risk management. She advocates for patient-centered care with integrity, fairness, and a touch of humor. Jill has always seen nursing as a diverse field with unique paths and believes in the difference that nurses can make in various roles. Jill, welcome to the show.
Thank you, Audrey. I'm delighted to be here.
Yes, I'm so glad to have you. So I know that, we want to end this conversation talking about your role as VP of Patient Services at NORD, but let's talk a little bit about how you got there. Talk to me about how you got into nursing in the first place.
So it's interesting. Some people just know they want to be nurses, and other people learn along the way, either in college or something happens. As long as I can remember, all I've ever wanted to be is a nurse. I mean, from the time I was a little kid, all I ever wanted to be is a nurse. And for as long as I wanted to be a nurse, I wanted to be an emergency room nurse. So that's kind of where I started.
Yeah, and I think it's interesting. Last time we talked, you said that at the time that you were going through school, it wasn't common for nurses to start out in the emergency room. Is that right?
That is right. Typically, when you think about the nursing path, everyone starts as a floor nurse in the hospital. And when you talk to classmates in nursing school, it's, I want to work in the hospital, or I want to work even in the ICU, or I want to work in labor and delivery. But most people's path starts out with working on a medical surgical floor. I wasn't doing that. I wanted to work in the emergency room, and I was bound and determined to do that. So I went to school at Northeastern University, and Northeastern has a co-op program. And my thinking behind this was I was going to come out of nursing school with a resume like this, and I was going to skip all of the stuff that went before and work in the emergency room. And I was, in fact, able to do that. Some of my co-ops were in the emergency room, And so when I did graduate from nursing school, I went right into the emergency room.
That's awesome. I also started my career in the emergency room, so I understand that. I actually think that working in the ER gives you such a strong foundation. It is a little bit of trial by fire, but I think that you get a strong foundation of working in that fast-paced environment. Every day is different. You don't know what to expect. You don't know what's walking in the door next. So you kind of get to try on a bunch of different hats and figure out what kind of patients you enjoy treating, if there's something that, you don't like. Because I started in the ER and then specialized to ICU from there, but I thought the ER was such a fun place to start my career.
I don't think there's any place that hones critical thinking skills like the emergency room. I'll give the ICU a close second, but it really does hone those critical thinking skills. And I think it also lets nurses see what the opportunities are. And as you said, what you like, what you don't.
Yeah, absolutely. And so how long were you working in the ER?
Uh, I was in the ER probably about 5 years, and I loved it right up until I hated it. Um, as happens to nurses and other industry and other folks, is I really did get burnt out. I was in the emergency room. It was Christmas Eve, and I had a gentleman with a stab wound to the chest sitting in a chair. It actually was an appropriate decision. He was the most stable person in the emergency room. And I felt like I had the weight of the world. And all of a sudden, I felt like I lost that edge to make those life and death decisions. And I said, I'm done.
Mm-hmm.
And so I left the emergency room, and I wasn't quite sure what to do. I saw an ad for called occupational health nurses, or at least that's what it was called at the time. In my mind, it was a lot like being a school nurse for adults. It was a lot of fun. You got to use all the critical thinking skills, got to do a lot of educational programs, a lot of preventative health, and all kinds of kind of different things. I think it's different for everyone that experiences it. And I did that just for a short period of time. And then I was home, I had my kids, and I stayed home for a while. And when I was ready to go back to work, there was a nursing home literally a half mile down the street from my house. I only wanted to go back part-time. I just wanted to dip my toe back in. How could I not do this?
Convenient, yes.
Yeah. I said, I can do this. I can do this. So I went to the long-term care facility and got to do a lot of different roles in there. But the director of nursing felt like with the emergency room skills, with these other skills, she didn't want me working on the floor. She wanted to use this to build her in-service department and her quality assurance department. Okay. And so I actually worked in long-term care for 13 years.
Oh,
But
wow.
what happened while I was there is one small, tiny, minor quality improvement project was looking at pain management in the long-term care setting. Well, that was it. I found an absolute love, a passion project. I researched, I went to conferences, I learned as much as I could possibly learn. I was able to try new strategies to develop programs. And out of all of this, I grew a consulting practice. I was still working in the nursing home, but I had a consulting practice where I was doing pain management and palliative care. If you will, it was the heyday of pain management. The Joint Commission was looking at it, CMS was looking at it. There was a lot of attention being paid. So I was lecturing, I was teaching, I was designing programs and projects. And it was great. It was great fun. I had the opportunity to work with the Joint Commission. I had the opportunity to write and publish a number of articles, a book chapter. It was great fun, and it really was new and different and sort of fed that passion for nursing again.
Yeah, absolutely. And so there's a couple of things there that I kind of want to talk about. The first one being the getting into the quality assurance piece of the work. I think that quality assurance is generally a path that nurses are aware of being out there, but a lot of times have no idea how to get into that. And so it's interesting that the opportunity for you just kind of introduced itself. Can you talk about any of the challenges or the things that you needed to learn stepping into that type of role when you were doing, a lot more analysis and, looking at these problems that you're trying to solve from a higher level?
It's a great question. Sometimes when we think about quality assurance, we tend to think about quality management and checking the boxes and doing audits. That's part of it. But to your point, the analysis, the what are we doing? What's working? Why is it working? Why isn't it working? And I have written on a bulletin board in my office, to improve quality, you need to improve the processes. It's still on my bulletin board. And I think we tend to get into here's the policy, here's the procedure, this is how we do it. And we don't always think about if that's the best way to do it. And so things that I had to learn were things like root cause analysis and asking why and asking how and looking at what those outcomes actually were. And were the outcomes living up to the benchmarks? And if they were living up to the benchmarks, is that as far as we could go? Just because it's good and just because it's done, is it really the best way for it to be done?
Right. Yeah. And the asking why, I think, is so huge. And I think that is kind of a personality trait, maybe in some cases. I think some people are just naturally curious and always asking why. And I think that makes a great person to consider these quality roles. And something that I think that a lot of nurses are good at just because of the environment that we work in and the way that our mind has to function to organize and prioritize through our shift is the process piece of that. I think that nurses are very process oriented. And so I think that allows us to be very skillful at a baseline, stepping into a quality type role.
I would agree with that. But I think the other part of it is I had an instructor, and I still remember this, and he told me the book is a compilation of things that worked once for somebody. And I really like that because here's the deal. Not everybody read the book. And our bodies certainly didn't read the book. And not everybody works exactly the same way. And there's so much else going on. And particularly, I think nurses are particularly skilled at looking at the whole person and saying, I get it. That's what the book says. I get it. It's a compilation of things that worked once. But this individual doesn't fit in that mold. Or they may fit in that mold, but this part is hanging out. And how do we do it better?
Yeah, absolutely. I love that, the quote from your instructor. I love those quotes that just stick with us for our entire career. The other thing I wanted to touch on was the opening of your consulting business. I think that consulting is obviously can be a very broad term. And so if a nurse is listening to this and they're working at the bedside and they hear the word consulting, I feel like that is a very vague thing. I think that a lot of people understand, like, okay, you have a certain expertise that is valued by someone else, but what exactly did that mean for you and your business? How were you going about consulting? Who were you consulting for, and what expertise were you providing?
It's a really interesting question. And for me, the answer is going to be different than it's going to be for other individuals. But think about how many times somebody comes up to you and says, let me pick your brain for a minute. Let me ask you, or I want to do this. How would you go about it? All of that is, in fact, consulting. And so what was happening is I had developed this pain management program in my nursing home. And then other nursing homes were approaching me and said, can you help us? Can you look at what we're doing? Can you help us to set this up? And so that's really how it started. And it went from there to, can you speak to this organization? Can you speak with the American Society for Pain Management Nurses? Can you speak to long-term care nurses? And then, as happens in the society that we live in, I was contacted by a number of lawyers that said, how do I know if the nursing home is doing it right? How do I know if there's malpractice there? How do I defend the nursing home to say they're doing it right? And so I started to do some medical legal review. And because I had worked in long-term care for so long, while my passion was related to pain management and palliative care, I started to get inquiries about pressure ulcers and falls and things like that. So it sort of grew in that aspect. As I was doing different speaking engagements, the folks from the Joint Commission were looking for who knows anything about pain management and long-term care. We're creating these standards. We need somebody to work with us. So I had the opportunity to work with them. And it just sort of grew from there. The business part of this started to take off. Then it was a little bit of marketing. And I was doing this in addition to working in the long-term care facility. So it was nice in that I could say, I'm going to travel 2 days a week or only 1 day a week, or I'm going to go a week at a time and then not for a week. So I was able to control that. And so some of that marketing had to do with outreach to who needs this information, who would be interested, who are the stakeholders. So I did a lot of consulting for some pharmaceutical companies. And once I started speaking for one pharmaceutical company, another pharmaceutical company, heard, and they started to call. And then a third started to call. And so it really does become almost a snowball where you have to decide, where do you want to focus? And what are you going to say no to? And what are you going to say yes to? And so that's really an important thing. Because every time you say yes to something, you're saying no to something else. So if I'm saying yes to a speaking engagement in Seattle, it means I'm saying no to a day of work in the long-term care facility where I was based. Or if I say yes to something in Pennsylvania, I'm saying no to the thing in Los Angeles. And you sort of have to weigh and measure what works for you and what works for your life.
Yeah, absolutely. And having that flexibility is huge.
Yeah.
Having that choice in the work that you're taking is definitely just a huge opportunity in and of itself. So after you found your passion in pain management, palliative care, you were hanging on to work at the long-term care facility, but also consulting. Where did you go from all of this?
So, you know the expression, life happens. Life happened. And I needed not to be doing that much traveling. I needed to be home more for my kids. I needed to be closer to home. And so I scaled back the consulting part of my business. And the long-term care facility where I'd been working, where I had so much flexibility to travel and do what I needed to do, it was sold. The new owners, it was not as conducive to that flexibility. And at the same time, I was offered an opportunity to start a nursing program at a proprietary college in New Jersey. And they were just starting the nursing program. They needed somebody to head this up. And I said, the opportunity to shape the next generation of nurses, to have nurses from day one thinking about pain management and palliative care, and for me to have some influence on what this is going to look like, because someday these people may be taking care of me. I like the idea.
Right.
And so I had the opportunity to start this LPN program, and it grew from a day program to a day and evening program on 2 campuses. I graduated 6 classes of nurses. It was fun, and it was fabulous, and it was stimulating. And then it became too much of a business, and I lost the opportunity to shape things in the way that mattered most to me. I also was commuting a very long distance, and at that same time, I had the opportunity. Somebody that I had known through my consulting business said, I need some help at a hospital's insurance company doing medical malpractice and risk management. And all of these oddball things you've done over the years, Jill, all of these oddball things will really do great in terms of risk management. Come work with me. Let's take a look at this. I said, well, I'll give it a shot. Okay. I really wasn't sure that this was going to be a long-term move or this was going to be anything that worked for me. But the opportunity worked for me at the time. I was there for 10 years.
Wow.
I really loved it. It was using all of those critical thinking skills. It was using all of those skills that we as nurses use to wrangle cats. And whether those cats are wrangling patients or wrangling clinicians or wrangling administrators, I got to do all of that. And as I said, I was there for 10 years. It was great. I enjoyed the work, but I was commuting 49 miles each way to and from work. We were building the business, but because of the way the company was leveraged and positioned, we weren't able to really grow the department. So I was taking on more and more and more. My boss was thinking about retiring. I wasn't able to bring on somebody to be, I figured I could be her. I could do that. That would be fine. But who's going to be me?
Right.
And I think as nurses, we tend not to think about succession planning unless we're involved in the business aspect of it. But it is important because as nurses, we always think about coverage, right? If we're going to call out sick, if we need a vacation, who's covering? Or if we know somebody's out sick, am I going to have to cover or am I going to have to find coverage? So we've always done it, but we've not thought about it from a succession planning standpoint. And this really became an untenable succession planning issue, plus the commuting. And I quite literally stumbled on this opportunity at the National Organization for Rare Disorders. Full disclosure, it was 7 miles from my house. That was really attractive. 49 miles, 7 miles, it really was very attractive. But we don't take jobs just because they're 7 miles. We take jobs because we get to make a difference. We get to use our skills. It's intriguing. It's inspiring. And working for the National Organization for Rare Disorders, or NORD, really gave me the opportunity to tie everything I've ever done up with a bow and make a difference every day. I've been here about 6.5 years, and I love it.
Yeah, that's incredible. It sounds like you've kind of just taken opportunities throughout your career, and they've all kind of led you down the right path in one way or the other. What was that first role that you took with NORD when you first got on with them?
I was hired as the Director of Patient Services, and that was really to lead our patient assistance programs. We provide financial assistance to the rare disease community, individuals who meet certain eligibility criteria. We are a 501c3 nonprofit foundation. And so it really was shaping not only what those programs should look like, but shaping a mindset so that we were taking a 360-degree view of a very diverse community. So if you work in respiratory, there's a fairly narrow swim lane in respiratory, except it's not so narrow, is it? Because the patient who has asthma is different than the patient who has COPD and is different than the individual who has cystic fibrosis or has respiratory syncytial virus. It's going to look different. Well, there are 7,000 plus rare diseases. So I'm in a lot of different swim lanes. And it was creating a system and a framework where we could take a 360-degree view of each of those rare diseases that we were serving and designing a program to meet their unique needs.
That sounds like a lot to keep up with. It also sounds like that is your kind of orientation to processes and process improvement coming back to the forefront. I'm sure that, the organization it must take to look at all of those different types of rare diseases and the programs that you can wrap up around those to support those patients is no small task. What is a day in the life look like in that type of role?
Well, it's interesting. It sort of reminds me of the emergency room days. No 2 days are exactly the same. And there's a lot of triaging. What's most important? What's the most critical need at this time? What can I give off to someone else to handle? What do I need to handle? What's a compliance aspect here? And so doing that sort of triage piece, not only on a daily basis, but ongoing throughout the day. Am I opening a new program? Am I wrapping up a program? Do I need to secure additional funding? Are the SOPs in place? Are we following sort of the regulatory component here? Are there agreements that are going to expire? Oh, wait, there's a new opportunity. A new drug is on the market. There may be an opportunity to open a new program and help another rare disease community. How do I leverage that? Ooh, here's the opportunity to put in an RFP for us to get a grant. So no 2 days are the same. And I envision my predecessors in this role approached it differently than I did. But it is a little bit, some days it's putting out fires, some days it's being proactive, some days it really is about what is my vision, what is my strategic plan, and how do I make sure that my department is on the right path. And I will say I'm very grateful. I've been able to grow not only the department, but the offerings and services that we provide. And I was promoted to the Vice President of Patient Services role so that I could use more of a strategic lens, so I can hand off some of the operational aspects. Although don't get me wrong, I function very much at the intersection of strategy and operations, but really to look at what is the strategy, what are the unmet needs, and identifying the unmet needs, and how do we meet them? Because we're a charity, because we're a 501c3 foundation, we're dependent on donations for all of the programs and services that we provide. Some of the time, I'm talking to donors and sponsors and prospective donors and prospective sponsors. Other times, I'm looking at what else can we leverage. And so in looking at those unmet needs of the rare disease community, I realized that there are so many individuals who more than anything need direction. They need somebody to tell them what to do. Where's the breadcrumb path to follow? And so I created an information and resource services team, everything that doesn't have a home somewhere else. I hired a social worker so she and her team could kind of go down the rabbit hole to find those resources to meet those unmet needs.
Yeah, that's incredible. And you really do get to advocate for your patients and what you're doing. You are making sure that they're taken care of, that they have all of the resources that they need. And I'm sure that you still just get, even though you're not at the bedside, this is just proof that you can have so much fulfillment in roles that are not direct, like hands-on patient care.
I would absolutely agree with that. I mean, think about how much time as nurses, whether you're at the bedside or whether you're not at the bedside, think about the amount of time that we spend talking to patients, whether it's to understand what their needs are and to help them to problem solve, whether it's talking with clinicians or other healthcare providers to advocate for our patients. It really is quite similar in that respect. One thing that I think is different is that in my role, I really am working with patients along the life cycle of their disease state or their diagnosis. So I may speak to somebody for the first time before they have a diagnosis, or they're newly diagnosed, or they've just received a diagnosis and they don't know what to do or who to turn to or how to find a specialist. What does it mean? What are they talking to me about? They're throwing all of these acronyms at me and all of these letters, and they're talking about genes, and they're talking about gene therapies, or they're talking about these medications, and the medication names are this long. And by the way, I can't afford the medication. And how do I even get these medications? And so patients don't know about specialty pharmacies, and they don't know how to navigate insurance, and they don't know how to live life with a chronic and rare disease. And so those are some of the opportunities that I have in talking with patients and talking with providers and talking with advocacy organizations and researchers and donors and potential donors. Wear a lot of different hats, but it's a lot of fun, and it really does use those critical thinking and advocacy skills just in a little bit different way.
Absolutely. And I'm sure there's a whole different level to the fulfillment that you get out of, like you said, the longevity that patient is with your program. Like you are with them from the very beginning when they are just overwhelmed with a diagnosis and information and trying to navigate our extremely complex healthcare system to when they find, oh, okay, like these people are here, they have resources for me, they can like guide me through this. I mean, the immense amount of relief they must feel when they get involved with your team and learn about how you guys can help them.
We really do get to make a difference every day. And when I bring on new staff members, it's one of the things that I can promise them. You will not be bored. You will make a difference every day. And we get letters and emails from patients and families and caregivers all the time. And it really does feed the soul when you hear, thanks to your program, thanks to what you did, I was able to go to my daughter's graduation. I picked up my grandchild for the first time. I was able to sleep through the night. And it feeds my soul in a very similar way to when I was working in pain management and palliative care. You really get to look at quality of life. It's not always about helping someone to live to 99 or 104. It's to help someone to live the best life they can for as long as that life is. And I'm really grateful that I have the opportunity to do that.
Absolutely. I think if you look at nurses just as professionals, broadly speaking, we are a group of professionals who bring a different kind of passion and empathy and drive to just make an impact and do good to our work, more so than many other professionals. And in doing this podcast, many of the nurses that I've talked to who are doing all kinds of non-traditional things with their nursing career, it's incredible to find that in almost every situation, that professional is still a nurse who is chasing a passion to make an impact. And it's amazing the different avenues that are out there for us to do that. When I was working at the bedside, like you, I said I started out in the ER, and I was 23 and I'm like, I'm going to be a trauma nurse forever. I love this. And then, like many nurses, the different things wore on me and I became burnt out. But I still have this passion to make a positive impact. And I think that a lot of nurses worry that if they leave, and I know I worried that if I left that position where I was hands-on with my patients and with them through a very traumatic part of their life, I thought, how am I going to feel fulfillment in any other role? And I will say the feeling is different. No matter what, it's going to feel a little bit different than actually like being hands-on with a patient. But that does not at all take away from the impact you can make and the fulfillment that you can feel in whatever it is that you end up doing. But I do just think that makes nurses really special professionals.
I would agree with that. And I would add to that I think the fact that nursing allows for such diversity, we can not only have that impact, make that difference, but we also can feed our own passions and our diverse needs and our diverse interests. Yeah, you don't have the win after a successful code, but I have to tell you, I don't feel any less excited or any less thrilled or any less fulfilled when I've connected somebody to the care and resources that they need.
Mm-hmm.
where I've enabled somebody to receive an infusion or a treatment that they haven't been able to access. Or when I'm told a story by a patient who said, because my medication is so expensive, I typically only can take the medication from January to June. I can't afford it after that. And so I have to go off therapy from June until the next year because I've met a maximum benefit. And it happens. That's the way our system is designed. I have to tell you, I don't feel any less fulfilled than I did walking away from a successful code.
Yeah.
It's different, but it feeds my soul. I know I'm making a difference. I can feel it. I can see it. I can touch it. And that's exciting for me. And it's exciting for me because I also have that opportunity, thank you, Audrey, to tell other nurses, you can do this. It's not going to look
Mm-hmm.
the same for you as it's going to look for somebody else. That's a good
Yep.
thing. That's how we get innovation. That's how we make these differences. If we all did things, here's the QA part of this. If we all did things the way, what we've always done and the way we've always done them, we would not be as far along as we are. Not as a profession, not as individuals, not as an entity delivering healthcare.
Spot on. Yeah. And I think that's what makes me so excited about doing this podcast too. It's just talking to all of the nurses who are making an impact in a different way and just sharing all of the incredible paths that nurses are out there pursuing. And, I know that, you talk about you love being able to like share your story and kind of how your path has transpired. But I also think that it can be hard for nurses to find mentors. I will say, actually, I feel like both at the bedside and away from the
Mm.
bedside, it can just be hard to find a really strong mentor. And I think sharing these stories is incredible because nurses can see the types of opportunities out there and that people are out there pursuing them. And hopefully it opens up some doors for connections and mentorship as well, because finding these non-traditional paths, it's not the path that's been laid out for us. We have to like seek them out and try be open to new experiences. So I think that, yeah, talking about this and sharing experiences is super important.
I agree. It's interesting. I have had the opportunity to precept a number of MSN students, and my last student, shout out to Catherine, she was fabulous. She was working on her capstone project, and she didn't want to do a traditional project. She wanted to do something different, and she scoured LinkedIn and was looked up nurses and looked at different nursing roles and looked at non-traditional roles. And she just out of the blue reached out to me and said, I'm intrigued. Would you be interested? Would you be my preceptor? I want to learn
Wow.
about nonprofit. I want to learn about what you do. Oh my gosh, I had so much fun. It was great. But we worked together and I got to teach her about what I do. But it also was teaching her and talking through, how do you figure out what comes next for you? What lights your passion? What looks right to you? And it's not just what looks right to you in terms of your nursing career, and that's critically important, but what's going to fit in your life and the
Mm-hmm.
stage of your life that you're in. For me,
Yes.
that's changed several times. And spoiler alert, it's going to change several times for any of you that are listening to this. I understand. All I ever wanted to be is a nurse, all I ever wanted to be is an emergency room nurse, and I'm far from that now. We don't know what we don't know. And so talking to people, reaching out, finding those mentors. I've been lucky. I found mentors when I was working in pain management. The sort of godmother of pain management is a woman named Margot McCaffrey. And Margot took me under her wing and taught me and introduced me to people. And I had other mentors along the way and just phenomenal, phenomenal people. I could name drop all of the pain management gurus of the world who were so kind. But at the same time, they were learning about long-term care, which had not been in
Mm-hmm.
their wheelhouse. So I would say to your point about finding mentors and reaching out, it really is a mutual relationship. You may be reaching out to somebody to say, would you help me? Would you teach me? Would you talk with me? Would you guide me? That's okay. And that individual who you've reached out to hopefully will give of themselves, but they're also getting from you. They're getting your interest and your passion and your experience, which builds on theirs as well. And so I really do see it as amplifying nurses and amplifying nursing and what we do as a profession and as professionals.
Absolutely. I cannot agree with that anymore. And I love your call out that whatever you choose is probably not going to be the thing for the rest of your life. And I think that's important for us to realize as bedside nurses, as nurses who have left the bedside, or nurses who are on our third or fourth role. Life changes, life happens, as you said, and each chapter is going to look a little bit different. And I know that I personally had a little bit of a struggle when it came to leaving the bedside because I felt so much of my identity was that bedside nurse. But what I learned is I'll always be a nurse,
Yes.
but whatever I'm doing with that is going to be different based on whatever chapter of my life I'm in. And so my 8 years that I spent in pediatric critical care, just a chapter of my career, a great chapter, but a chapter of my career that fit my life at that time, built a strong foundation. And the chapter I'm in is just a chapter. And I'm sure, as you said, something is going to change and it will change again. But I think that the foundation that we get as nurses, I really do think is so strong. I mean, just in this conversation, we've talked about the many skills that we develop through nursing that can serve us in so many different ways. And so I think it's really important in whatever phase you're in, just pay attention to what those things are that you're doing every day that have transferable value. Like we've talked a lot about critical thinking and the ability to be able to connect with people, our interpersonal skills. Those things can take us into all types of positions. And so I think it's really important to, even at the very beginning of our career, just reflect on what those things are.
And I think you have to be open to sort of following the yellow brick road and following that passion. And yeah, it's scary. Absolutely, it can be scary, but it can also be so rewarding. And here's the deal. If you make a mistake, do something else. That's one of the wonderful things about nursing is it does enable such diversity and innovation. I mean, when I was in nursing school, I don't think there was such a thing as pain management nursing. Palliative care was hospice care, and it's not the same thing. So I think things grow and develop as we innovate, as we see a need, as we identify a need, as we follow a passion, and really as technology changes.
Yeah, absolutely. Jill, I think that you've helped share some really important messages with us today. I know that, learning about your work at Nord and the fulfillment that you're getting through your job and the impact that you're getting to make is really special to hear about. So thanks for coming on and sharing your story with us and sharing your message. If you'd like to learn more about Nord, you can visit their website at rarediseases.org. You can also connect with Jill directly by reaching out to her over email at jpollander@rarediseases.org. You can find all of this in the show notes below. Thanks for tuning in. Don't forget to hit subscribe to keep up with our latest episodes. And if you were inspired by today's conversation, I hope you'll share this episode with someone who'd love it just as much as you did. If you're ready to pivot your path, visit the job board at jobs.mypivotpath.com. And if you have any questions or just want to say hi, feel free to email me at audrey@mypivotpath.com. Thanks for listening, and we'll see you next time.